I consent to this video.
Alright, so first things first, I'm going to enter the patient's room. I'm going to wash my hands, make sure I have all supplies necessary on hand. I'm going to introduce myself to the patient. So hi, my name is Coffman. I'll be your nurse today. And I'm going to ask my patient to identify herself with 2 identifiers. So what's your name?
Ashton Castle.
And what is your date of birth?
August 2nd, 2000.
Perfect. So I'm going to make sure my patient has privacy, so I'm going to close the curtain, or in this case, close the door. I'm going to go over the procedure we're doing today. So today I'm going to be doing a head, eyes, ears, nose, throat, and chest and abdomen assessment today. And I'm also going to go over the medical order and make sure I am doing the correct procedure. So the first thing we want to start off with is a medical history. So Ashton, do you have any history of COPD?
Nope.
And have you ever had your tonsils removed?
Nope.
Okay, so we want to ask questions that have to do with the assessment that we're doing here today. The next thing we're going to do is get a patient orientation and consciousness level, so we know if she's within the right mind and knows what's going on. So first, I'm going to note that Ashton's been sitting up. She's been making good eye contact with me the whole time, and she appears to be nodding along and knows what's going on. Next, I'm going to ask her 4 questions. What's your name?
Ashton.
Where are you?
In a bedroom.
What time is it?
About 12.
And what are we doing here today?
An assessment.
So she appears to be alert and oriented ×4. She knows exactly what's going on. There's no issues there. Next, we're going to take note of physical appearance and things like that about Ashton. So first, her clothes are appropriate and in good condition. She's not disheveled in any way. Ashton, how are you feeling today?
Good.
She's in a good mood. She's smiling. Her words matches her actions, which is also a good sign. And the other thing is, since she's been speaking to me, she's been clear and articulate the entire time. So there's no issues there. So now we're going to move on to more of a visual inspection of Ashton. So we're going to start with her face and its symmetry. So she has 2 eyes, both sides of her face, symmetrical and even. She has a nose that is midline and a mouth, and they're both symmetrical. And her ears line up, the top of her ears line up with her eyes. So at rest, she does have symmetry. So now we're going to test for emotion. So puff out your cheeks, smile, frown, and raise your eyebrows. And symmetry appears to stay consistent even with movement. So then from there, we are going to note her skin color is very pale with pink undertones. There doesn't appear to be any lesions or abrasions, and it is in good condition overall. And then we'll go to her hair, which also appears to be clean, well groomed. There's no indication of any outside bodies, and there's no balding anywhere, so that's good. So the next thing we're going to do is we are going to move on to looking at her eyes. So the first thing we're going to do for that is we're going to have Ashton pull down on her face a little bit and look around the room slowly. And as I look at her conjunctivus and sclera, her sclera is white and bilateral, and same for the conjunctiva. It is bilateral and is clear. There doesn't appear to be any drainage anywhere. So from there we can move on to Perla, which starts off with me measuring Ashton's pupils to make sure that they are equal. And it appears we have a 5 on one side and a 5 on the other, which is equal. Both pupils were round, there's no abnormalities, so we're good there. The next thing we're going to do is do a 6 position test to test the ocular nerves 3, 4, and 6 to make sure that there's no astigmatis or anything like that. So Ashton, I'm going to have you follow the tip of my pen without moving your head or your neck. So Ashton was able to follow my pen evenly, both eyes symmetrical, and there was no astigmatis. She didn't seem to be in any discomfort either. So now we're going to do light tests to test the pupils and how they react to the light. So first I'm going to do a direct light test. So Ashton, please look over my shoulder. Try to ignore the light as much as possible. I'm looking to see if the pupil constricts upon direct light, which both sides do appear to do. So now I'll do indirect, where I look at the opposite side, and once again, both pupils constrict evenly and without issues, so we're good there. And then finally for Perla, we're going to do accommodation. So Ashton, I'm going to have you look at the tip of my pen as it comes closer to your face. And both pupils both converge on the pen light and they constrict, so she is able to focus on it, so accommodation is also good. That's it for the eyes, those are good. So now we're going to move on to the lips, mouth, and throat area. So the first thing I'm going to note is her lips. They're pink, there's no abrasions, there's no cuts, and they don't appear to be dry or cracked, so they are in good condition. the next thing I'm going to do is I'm going to pull out my tongue decompressor, and Ashton, I'm going to have you open your mouth as wide as you can, and I'll try to cause as little discomfort as possible. So the first thing I note is tongue appears to be in good condition on both sides. There's no abrasions or drainage anywhere in the throat. It's pink, there's no redness anywhere or drainage anywhere within the mouth area. The next thing I'm going to note is as I go back in the throat, I do see the presence of tonsils, which is indicated in our patient history. They aren't touching, there's no drainage on them, so I would give them a grade of 1. And the final thing to note would be the teeth. They were white. I counted 28, and there was no evidence of dental caries. There was also no odor present in the mouth, so that is also a good sign. So the next thing we can do after that is we can move on. I will discard this because obviously it is now contaminated, and we will move on to the neck. So first thing I'm going to do is ask Ashton permission. Am I allowed to palpate your neck?
Yes.
Perfect. So the first thing I'm going to do is look at it first, note any redness, edema, swelling, which I see none of. So then I will palpate lightly and find the trachea. It is midline, it is symmetrical, and then I will move outwards looking for any bumps or any areas of concern from the neck, which I find none. So the next thing we can do is move on to breathing. The first thing we do with breathing is we note Ashton's general, the way she's sitting and how she is getting her breath. So she's not in tripod position. She doesn't appear to be breathing labored in any way. She's breathing room air, and she doesn't have any history of any lung issues, so that's also good. So the first thing we're going to do is, Ashton, I'm going to have you stand up, and I'm going to have you take your shirt off. And the first thing I'm going to do is put both hands on Ashton's back, and I'm going to first assess to see if there's any spinal issues. So, sorry, will you turn this way? I find her spine, it is midline, there doesn't appear to be any variance, it goes straight down, so we're good there. The other thing I'm going to do is I'm going to place both my hands with my thumbs up on her back, and Ashton, I'm going to have you take a deep breath. And I felt about 1 inch of chest expansion, so her rib cage is expanding as we would expect. So the next thing I'm going to do is I'm going to actually listen to her breath sounds. Now, if this was real life, I would have the patient remove all clothing in the top and everything, but for the sake of me and Ashton's friendship and what we're doing here today, we're just going to have her keep it on, so bear with me with that. So Ashton, I'm going to have you take a deep breath in and out on each spot that I move my hearing piece, and I'm going to do 10 to 12 spots ending at the base of the lungs and mid-axillary. So go ahead, Ashton. Then can I have you lift your arms just a little bit? And the other side. So for breath sounds on the posterior side, they were all clear. I didn't hear any cracking or anything that would be any concern. All the lung sounds were clear, and they were also bilateral. So then we're going to do the anterior side, which is the same thing. I'm going to start above the clavicle and be careful not to be on any bone. And once again, the patient is female, so if need be, I would have her displace her breast tissue, but for today's purposes, we're not going to do that. So Ashton, I'm going to have you take a deep breath on each spot once again. All right, and once again, both sides are bilaterally clear. I don't see any issues with the lung sounds at this time. So next, we're going to move on to our assessment of the abdomen. So for this, I'm going to have my patient lay down in supine position. I'm going to make sure that she is comfortable, and I'm going to make sure also that she is properly draped in any way for privacy. But I want to make sure that all 4 quadrants are exposed, but the patient is also comfortable. So the first thing that we're going to do with the abdomen is we're just going to take a look. It appears that there's no abrasions anywhere, any lesions. The skin is also pale with pink undertones, which is consistent with what we found with the rest of her body. And we're also going to get down and look at her stomach. It doesn't appear to be distended in any way, and it appears to be flat. Also, the umbilicus is in the center of her stomach, separating all 4 quadrants. It is inverted, and it appears to be clear, and there's no redness or drainage within it. So the first thing we're going to do is take a listen. Ashton, do you have any pain in any parts of your abdomen today? So if Ashton did have any pain anywhere, we would start in a quadrant where we would end up in the quadrant that she had pain in at the end. But because she doesn't have any pain today, we're going to start in the right lower quadrant and listen to 2 spots on each side, or in each quadrant, excuse me. Alright, so in each quadrant, I did hear small clicks and gurgles. I heard about 8 to 10 per minute, which would be considered active bowel sounds. And I didn't note any abnormal sounds, so we're all good there. The next thing I'm going to do is palpate her stomach. So I'm going to take 2 fingers in each quadrant in the same way that I just did, 2 spots in each, and in a circular motion, feel for any tenderness. And I'm going to ask Ashton to report any pain or tenderness in any of the spots while I do so. So Ashton, if you feel any pain or tenderness during this whole part, please stop me and let me know. So my patient didn't report any pain or tenderness, and I did not feel any distension or anything I would not expect. So we're all good there. So finally, we're good to go on our assessment. So we're going to close up with our patient. So we're going to make sure that Ashton is in a comfortable position. We're going to make sure that she has any personal items that she needs within her reach. Oh, actually, I did forget one thing. Can I have you stand up one more time? I'm going to do kidney percussion to make sure she has no kidney pain. So I'm going to take my hand, have it flat, and then softly tap and ask Ashton to report any pain. So first, this side, any pain?
Nope.
And the second side, any pain?
Nope.
So her kidneys also appear to be in good health. So now we'll close with the patient. So we'll make sure she's comfortable in her room. We'll make sure the bed's at its lowest position. Any personal items are within reach. Also the call light if she would need us. And we'll also make sure that the side rails are raised ×2. And after leaving the room, I will make sure I wash my hands and report and document all my findings.